Hey everyone, so April is designated as Cesarean Awareness Month, and I feel like it's important for us to talk about it because cesarean birth is birth. However, we know that it is not highlighted as much as vaginal births or home births or unmedicated births, etc., right? Um, Most women do not plan for a cesarean birth. However, some women do for various reasons. Okay, it is a woman's right to give birth in whatever fashion she feels is best for her. But we do know that for mothers who do not opt for cesarean birth, some mothers do end up giving birth through cesarean. We know that 30% of all births in the U.S. are cesarean deliveries. And we also know and acknowledge that there are medical reasons for cesarean birth and also non-medical reasons for cesarean birth. Okay, so I just want to highlight a couple things and talk about a few topics regarding birth via C-section. Okay, so let's talk about a few medical reasons where a cesarean section would probably be the best option for birth. Okay. One reason is fetal intolerance to labor. That means that baby is showing signs of distress during labor, and delivering the baby sooner than later is probably the best option, and that would be via C-section. Prolonged labor or labor dystocia is another reason why cesarean birth might be a better option for a mom. If she has been in active labor phase for hours without any cervical change or very slow cervical change due to fetal positioning or the baby not descending into the pelvis, sometimes a cesarean section is discussed and probably the best option for her, because there's some reason why the cervix is not dilating as it should be, especially if there have been different positioning techniques and things implemented to try to facilitate change that have not been working and have been unsuccessful attempts. Cesarean is usually an option for those mothers. There are different conditions with our placenta that would require a cesarean section, okay? One is the placenta previa, and that is when the placenta implants over the cervix. And if a mom labors with the placenta over the cervix, her risk for bleeding and hemorrhaging are high. So the requirement would be for her to be scheduled for a cesarean before labor starts, okay? Another condition with the placenta is an abruption, all right? Some mothers may have, and this is an emergent complication, okay? If the placenta detaches from the uterine wall, that causes bleeding and risk for the baby, okay? That would warrant a cesarean section in an urgent matter, all right? Sometimes the cord can slip through the vagina. That's called a cord prolapse, okay? That is an obstetric emergency, which would require a cesarean section immediately, all right? So those are more medical problems that would require cesarean section. Other reasons that would require a cesarean section, okay, would be if the mother's health was at risk, all right? So if we have an unstable maternal status, okay, health status, and her life is at risk, and the cesarean birth is the quickest resolution, that's when a cesarean section would also be required. So one of these conditions could be if a mom was severely preeclamptic or hypertensive, and birth, we know, is the first line of treatment for those conditions. If a mom's health state was deteriorating, okay, and birth needed to happen sooner than later, cesarean section would be recommended and required, okay? So, there are reasons why cesarean birth is necessary, especially when we're talking about saving the life of mom and or baby. So let's talk about some things you can do to decrease your risk for having a cesarean section, okay? Now we're talking outside of the things we cannot control, okay? We can't control every condition that may come up in pregnancy, right? But there are some things that you can do and decide on to help reduce your risk for a cesarean. Number one would be to choose a provider wisely, okay? If you are going to a provider who you know is quick to cut, who doesn't give laboring moms a chance to birth vaginally because they're very in a much hurried state and they're ready to just get you delivered and move on to the next mom, that may not be the provider for you, right? A second idea would be to hire a doula and to also get as much childbirth education that you possibly can to help you prepare and to help you become your own best advocate for yourself, okay? So one huge tip to prevent a cesarean section is to refuse or say no to the elective induction, okay? Some providers will see you at 40 weeks and say, hey, you're 40 weeks, it's your due date. Let's go ahead and schedule you for your induction because you've reached your due date. It's just time to have this baby, you know? There's no medical reason as to why you need to have your baby just because you've reached your due date or have gone a couple of days past your due date. Just say no, refuse it, you know, and ask questions and say, why do you think I should be induced? Is there a reason why? Am I in danger? Is my baby okay? Is there any medical reason why I should be induced? Doesn't medical induction increase my chances for a cesarean section? That's what the data shows. You know, you need to know these basic facts so that you can use that during your prenatal visit with your provider who is offering an elective induction, okay? So that you can let them know, nah, I'm not really on that. That's really not what I want to do. I'd rather wait as long as I can for my body to kick in, if at all possible, please. Because I don't want to increase my risk for a cesarean section, okay? That is completely legitimate. That is a completely reasonable conversation and request to have with and of your provider, all right? So that's a huge one there because all the data supports the fact that medical induction increases your risk for cesarean section later on. So make sure you understand that concept and be ready to say no to the elective induction with no medical reason. Okay, so this is for the mamas who know they do not want to birth unmedicated and they want that epidural. Nothing wrong with it. But we know that epidural anesthesia also can increase your risk for a cesarean section. So a tip for you is to arrive to the hospital in labor, okay? Don't go at the first sign of a contraction or a cramp, right? But make sure you're in a nice labor pattern so that you can be dilated at least to maybe 4 centimeters, okay? What's even better is if you're dilated to at least 6 centimeters, right? So that's a little bit of laboring going on, right? But at least you can get to the hospital in labor and receive your epidural while you're in labor versus, you know, going in, you're 1 centimeter and you asking for the epidural. Because we know that the epidural does slow down labor and it does limit ambulation and movement in labor. You can't move when you have an epidural, right? You can't get up and walk and things like that. So because of that, you know, the baby sometimes has a harder time trying to navigate through your pelvis because you are laying in bed for hours during your labor, okay? So that can sometimes impede cervical progress, all right? So if you're a mom that wants an epidural, I hear you. Just make sure you try to get to the hospital in active labor if at all possible. Hire a doula during that early phase of labor so she can support you so that you can get to the hospital and request your epidural because you are 6 centimeters or more, right? So that's a tip for you. So mothers who have had cesarean still have the option to try for vaginal birth for subsequent births, okay? Just because you've had a cesarean does not mean that all of your births in the future need to be cesarean births. The trick here is that you will need to find a provider who supports VBAC and offers VBAC service, okay? That's probably going to be the most difficult task for you, to find a doctor who is going to allow you to VBAC to try for your vaginal birth after cesarean. So that will probably be on your list, the top of your list of things that you need to be inquiring about before your next pregnancy, when planning for your next pregnancy. Now, not every mom who has had a cesarean desires to birth or try to give birth vaginally, and that's completely fine too. That is her right. And if you know that you want to go in and have a repeat cesarean section for all of your next births, that is totally okay. All right. But what I would encourage you mothers to do is to find a provider who offers the gentle cesarean technique, right? Who offers the family-centered cesarean. And that is when you are allowed a family member inside of the operating suite. The drape is lowered during the emergence of the baby when the baby is born through the abdomen. And they allow skin to skin right after the baby is born. That is a gentle cesarean, okay? When they respect the physiology of birth, okay, in the operating room. So that would be my suggestion for you mothers who would desire a repeat cesarean, is to find a provider who can at least offer you a gentle cesarean or a family-centered cesarean birth for your next experience. So for mothers who have planned for vaginal births and ended up having a cesarean birth instead, I know personally some mothers who have experienced that, and we've had really good outcomes nevertheless. However, I know that there are some emotional components to that process in which needs to be, tended to. So I just want to let you all know and remind you that you didn't fail at anything. No one is disappointed in you. You are not faulty. Your body is perfect the way it is. And I celebrate you as much as any other mom who's had any other type of birth. I mean, you are an amazing person with an amazing body who created life and gave birth to a baby. And you matter and your feelings matter. And I refuse to let you fade into the background, okay, as we move forward and celebrate birth in every way. All right. So you are still special. You are still a mother. You are still badass, okay, at what you're doing as mom right now. And whatever I can do to support you through or help you navigate through any feelings or connect you with anyone who can help you do that, I'm here for you always.